We're going to call this episode, and maybe even a series, Real Talk, Pet Parent, Dog Parent Question and Answer. So, this is based off a question I got, and it's a conversation that I have quite a bit in practice, face to face with pet parents, maybe very similar to you, about dentals, having a dental performed on your pet, the concerns. I have to put my pet under anesthesia. And so I recently had a dental performed on my dog, and this question was brought up to me was, hey, my dog is 3.5 years old, presumed healthy. I know it needs to be done, and I'm nervous. Can you talk a little bit more about dental disease and dentals? And I hear you. My dog just had a dental cleaning. In fact, this past week, we were at, the latter part of May, and I know he was in good hands. I know he's as healthy as possible. And I still was nervous because unfortunately, I have seen things go wrong, even though they shouldn't have gone wrong in anesthesia. And not because anything was done incorrectly, but because unfortunately, the cards were just against us in some reason that sometimes we never find out. So I understand as a pet parent that hesitation on wanting to do what is best for your pet and also knowing that there are some risks involved. So I want to talk to you about dentals and dental disease and maybe helping you understand how dental disease really affects your dog or your cat's overall health, that maybe you'll look at it very differently and have these conversations with your vet rather than just shutting it down. Because what I see happen quite frequently is it will be put off, put off, put off. And then when it's done, the patient, the pet, is under anesthesia now for 3 or 4 hours and having multiple teeth extracted. So there's a lot that comes with that. There's pain management, there's inflammation management. Now there's the anesthesia and the detoxing, not only the financial investment for you too. So how can we come to a very happy medium ground where there's enough dental disease to warrant the anesthesia, while also our patients aren't under very long? And so I want to talk to you about the importance of it. And I have some notes here because there's specific things that I want to hit on. And I want to tell you the quick story about how my dog just had a dental. I didn't wait until his teeth looked like barnacles on the back of a boat hull to have it done. I did it because I knew he had enough dental tartar, dental calculus, and gum disease to warrant it. It had actually been 18 months since his last dental, which I think is a great amount of time to have between dentals. I think that's wonderful. And why it's wonderful is because he wasn't overdue for it in the sense that his teeth were severely diseased. He had enough that I felt comfortable that, yes, I know the risk with anesthesia. And also I know that he's got enough dental disease for us to address the scale and polish and get rid of it and get under that gum line. Because that's where a lot of dental disease starts from. It's under that gum line. And then we see it kind of coming out, that brown stuff that you're like, I just can't brush it off. You're not going to because it's calcified tartar. And so I get it. I was just there with you. And so were his teeth bad? They weren't that bad. There was some discoloration in one side more than the other. He had typical dog breath. He is a dog. I don't brush his teeth as much as I should. I do home dental care. I wanted to be proactive. I wanted to be proactive in the sense that I wasn't waiting until his teeth were really bad and now he was going to be under anesthesia for hours and hours. I think he was under for a total of maybe an hour yesterday for both sides, including dental x-rays. That is really efficient. I want to be proactive because I know that the bacteria in his mouth talks to the bacteria in the rest of his body and his gut. And that gut talks to the rest of his body as far as inflammation and immune system. So I wanted to be proactive. Dental disease isn't just about bad breath or cosmetics or a pretty smile for your dog. It is a window into their health because that is a gateway for the rest of the bacteria in their mouth. And it goes beyond of what's just in their bowl when it comes to their food too. So dental health really matters because on average, 80% of dogs, and so we're just talking dogs here, 80% of dogs over the age of 3 have some form of dental disease. So we can see it in all different stages, all different ages. Some dogs accumulate more than others. And there are a few factors that go into it. But the concern is that it's not just that, okay, it's not pretty or their breath smells, is that is a form of inflammation. And that inflammation here can lead to systemic inflammation or influence on their systems, their liver, their kidneys, their immune system. And if it's affecting their immune system, what are we setting them up for? Are we setting them up for autoimmune conditions? So it's not just about their teeth falling out. It's not about just about the bad breath. It's not about their teeth not being as white as they were when they were puppies. It's about immune stress and chronic inflammation. And what is that doing for their long-term health? What is that doing for their lifespan? What is that doing for everything else that they may be dealing with? And so you can't outbrush a bad diet. You can't. So it really can start with their food. And spoiler alert, kibble is not a toothbrush. It's not. And the reason I say that is last time you ate crackers, or let's say a chip, did it clean your teeth? Think about it. Saltine crackers or something with crunch. Did it clean your teeth? Or did it get stuck in your teeth? That's the same thing when it comes to our dogs. We need to really maybe rethink about kibble and how it can influence their teeth. And most kibbles, and this is why most kibbles, most traditional kibbles, I guess I should say that, can be high in carbs. Those carbs convert to starches or sugars, and they can form this like sticky texture on the teeth. That's a breeding ground for bacteria. They love that. So I know I've been taught, and there was one point where I thought, oh, kibble, it helps. It's crunchy. It's scrubbing the teeth. And yes, there are some kibbles out there that have some really specific science into it and how it is crunched and how it is broken apart, that maybe it can cause some gum stimulation, which can help with dental health. Absolutely. But a traditional kibble that is going to be very carb rich is those carbs convert to starches and sugars. And then what are we left with that? Especially because here's a little tangent. Our dogs don't traditionally have the digestive enzymes in their mouth to break down these carbs. So they're sitting around and they're getting sticky. So other factors can affect your dog's dental health. Of course, diet. So is it very carb rich, and where are these carbs coming from? Are these starchy carbs? Are they simple carbs? Are they complex? How much is in their diet? The type of food that they're being fed. Is it whole food? Is it traditional kibble? The bacteria community in their mouth. So the bacteria community in their mouth also talks to their gut. It's not isolated. And it's very easy to think that it's so isolated because there's so much landscape in between the mouth and the gut, right? You have the mouth, you have the back of the throat, you have the esophagus. You're like, is there a connection? There's absolutely a connection. The immune system strength can be affected by the nutrition that they're eating, their stress, their genetics, absolutely, their environment. So we also have to look at their immune system. How strong is their immune system? Is their immune system being challenged by any of these things? Is their environment stressful? Can you control that environment? Is it being influenced by their genetics, potentially? Is it being influenced by stress, whether it's in their environment or not? Their anatomy, their jaw structure, do they have an underbite? Especially these smushy faced dogs. I actually heard a colleague talk about it's like putting a whole bunch of dice or teeth in a cup and then shaking them up and then going Yahtzee and like throwing them out and being like, that's just where they go. Some of these smushy faced dogs, their teeth are all crowded, and that absolutely can affect dental health because you have all this crowding in there. And so dogs typically, I'm not going to say always, because I feel like there's always an exclusion to the rule. Dogs typically on more processed food can sometimes have more advanced dental disease, while dogs on less processed food can sometimes have less dental disease or delayed dental disease. I'm not going to say that they are immune to it. And I firmly believe, since switching my dog's nutrition back in October 2024, we are now in May 2025, I really think it's contributed to why I was able to get extra time between the dentals. And fun fact, that dental in November 2023 was his first dental cleaning he had ever had. And so we are now May 2025, and he's going to turn 8 this July. And so talking about the bacteria here in the mouth can influence the bacteria here in the gut. When there is an imbalance, or you might hear the term dysbiosis, it can lead to systemic inflammation. So inflammation in the whole body. It's just not isolated in the mouth. It can be just the mouth, but that can influence everything else. They're connected. Think of this is a roadway between the mouth and the gut. Think of the mouth as your dog's mouth is the lobby and of the digestive system. Imagine if that lobby was crumbly and dirty and unkept. Likely the rest of the building is very likely to be in the same standard. So think of your dog's mouth, again, the lobby, the place where you enter. If that's not doing okay, how's the rest of the system in the digestive tract look? Poor gut health or less than ideal gut health can influence your dog's immune system, which can lead to more plaque and more gingivitis because that immune system is not up to par. And when you have an immune system not up to par, you're going to be more susceptible to diseases and inflammation. That's what gingivitis is inflammation of the gums. Periodontal disease, that is inflammation of the mouth, dental disease. And so dogs with poor gut health or suboptimal, we'll call it gut health, often have bad breath, excessive plaque, maybe gum bleeding, slower healing in the mouth if they were to get a lesion or ulcers. Now, what I'm not saying is that dogs with good gut health who don't have bad breath, right? What I am saying is that dogs who have suboptimal gut health tend to have even poorer bad breath, gingival issues, bleeding gums. Maybe they need dental more frequently. So it's something for you to consider. So in humans and animals, I found this very interesting, is that there are types of bacteria that are related to dental disease and maybe inflammatory bowel disease, and that there may be a connection between them, such as fusobacteria. That if there's an overabundance of this bacteria and overgrowth, again, it's how it's all connected. It's kind of crazy and cool at the same time when you think about it. Antibiotics that your pet may go on for whatever reason. Seed oils in their food and their treats, especially if everything they're eating has these seed oils. Sunflower oil, safflower oil, or I'll just call them omega-6 oils, vegetable oil, canola oil. And if they're having a very carb-heavy food, that all shifts the gut flora, that all shifts that bacteria community in their gut and can affect their oral health, their oral gut. Their oral community of bacteria. It's all, I want to say oral gut because it's all connected. And so when that lining of the gut becomes damaged because of this inflammation, maybe you've heard the term leaky gut, it becomes permeable. That's when toxins can leach into your dog's bloodstream. And that's where sometimes we can get the inflammation, the food allergies, the autoimmune conditions. So there is this cascade that can happen from your dog's dental disease. And maybe, again, it's not necessarily just based on food. There's other factors that can affect it. But how this can have this whole effect. And again, it's almost like this infinity, and then how that can affect then the oral health because of the bacteria in there and the immune system. So when you have chronic inflammation, it can activate the whole immune system in the whole body, including the mouth. So looking for signs of red gums, maybe mouth ulcers, although they're not typically common. Worsening plaque despite maybe good hygiene. Maybe you're brushing them. Maybe you do, and this is on a consistent basis. And I say that because I commonly hear pet parents say, oh, I have their teeth brushed when I go to the groomers. I'm like, cool. How often do they go to the groomers? Oh, like every 3 months. Okay. So them having their teeth brushed every 3 months is not hurting them, but what value are we getting out of it? Imagine if we only brushed our teeth every 3 months. We're not getting that full effect unless you're also doing something at home that is really oral health, dental health supportive. Are you rubbing their gums? Are you brushing their teeth? Are you adding dental powders to their food? What are we doing specifically for the dental health? And if we see all these signs, red gums, ulcers in the mouth, horrible bad breath, despite really good hygiene, it should clue you in and be like, okay, again, because that is the window to the rest of your dog's health. What is going on with their health, their gut health? Are we okay? Because it's, especially if it's not matching, or all of a sudden I'll hear pet owners say, all of a sudden their breath is horrible. Of course, we want to rule out that they don't have any oral tumors or oral masses or anything specifically going on that is very primary in the mouth, that there's something specific in the mouth. If there's not, man, we got to look at that gut. We really got to peel back the layer on the onion on that. Dogs on fresh food or fresher foods or less processed foods tend to have a different bacteria in their mouth, a different community that is more beneficial for them. And they tend to have lower levels of plaque-forming bacteria. There's a little bit of a shift in this. And so what you can do, in addition to being mindful of the type of food that you're feeding your dog, and let's just say you're like, I'm sticking to kibble. It's what works. My life is crazy. It fits in my budget. Ain't broke, don't fix it. Think about supplements for your dogs, an omega-3, a well-balanced probiotic, oral health care at home, dental powders. And when you're looking at dental powders, be very read the ingredients, be very intentional. If there's a whole bunch of starchy ingredients, carbohydrates, rice, molasses, why? It doesn't need that. Maybe it needs it so that that product can stay together. So it's from a structural component. Ingredient wise, your dog doesn't need it for their oral health. So I would be very, very simple on what I'm looking for. Kelp-based products tend to do very well. Neem-based products tend to do very well. I've seen articles talking about baking soda and coconut oil. So be simple is best when it comes to dental health products, in my opinion. We don't need all that extra junk being added to it. So if your dog's gut is out of whack, it's very likely their mouth is going to show it. It is very likely that it's going to help clue you in and give you kind of like the nudge. Like, hey, look a little bit farther. And I don't think we're having these conversations enough in practice and wellness visits. Especially, I will see pet owners, dogs and cats. It's a little bit more for dogs, but dogs and cats. Then I'm like, oh, I think we should do a dental cleaning. And I try and look in the chart and see when the last dental cleaning was. And they're like, I just had one. And I'll look and I'm like, it was 6 months ago. And I'm like, oh my gosh, this dog looks like it hasn't had a dental in 2 years. And so that's what I would be wondering, like, what is going on with this pet, with its immune system, with its inflammation, with its gut health? What can we do to find out more information? What specific testing can we do? How can we look at the diet? How can we look at the treats? I get it. Dentals take time. You have to take time off to drop off your pet and pick them up. And there's the concern of, are they going to do well under anesthesia? Even when we do everything possible to help with that. I get it. So what can we do to support so that time between dentals gets longer while also not compromising their oral care and oral health in between? Brushing your pet's teeth, and I'm talking to mainly dog owners because I don't know many cats that get their teeth brushed. I'd love to know. Please message me if you brush your cat's teeth because I want to cheer you on. Brushing the teeth helps the symptoms, but how can we get to the root cause? Is that balancing the gut? Is that checking the gut? What can we do for that? So are professional dental cleanings necessary? Yes, I absolutely believe they are. And in fact, the person who messaged me that started this question and answer for this podcast was like, what about the anesthesia-free dentals? I'm hesitant on them. And I'm hesitant on them because, and I get it. I get the purpose behind them, why owners are wanting them for multiple reasons, but also, are we accomplishing what we're wanting to do? How are you able to get back in the back of that mouth and move the dog's tongue with them awake and being aware of their gag reflex and making sure they're not aspirating anything? How are we able to effectively do that? So I do think that professional scale and polishes with the care of a veterinarian or a veterinary dentist are typically best, typically for most pets. And it's different for each pet on when that needs to be done. That may be every 12 months. In fact, I was just talking to a colleague today. She's like, every August, my dog gets a dental cleaning because she needs it. So it's very different per pet. So yes, I do think that they are very beneficial. Don't ignore the severe plaque. Don't ignore the bleeding gums. Don't ignore the red gums. Most of that is, it's time for the anesthesia dental. And the benefits are going to far outweigh it. And yes, there are risks with anesthesia. I'm not going to say that they're not, but how can we minimize that risk? So things you can do beforehand, getting blood work done on your pet as close to the procedure as possible. So it's almost in real time. Having your pet an ideal weight that is going to improve their recovery, improve their anesthesia. And how can we decrease other inflammation? How can we address other comorbidities? Do they have heart disease? Do they have kidney disease? Do they have diabetes? Checking all these boxes and making sure they are regulated as much as possible. Because the cleanings don't necessarily prevent the disease, they treat it. They're not going to necessarily prevent it. So what we do at home can help manage it. That is with their diet. So that is, how can we have them on a less processed diet, being mindful of the macronutrients. So when I say macronutrients, the protein, carbs, fiber, fat, and maybe having it less processed. The supplements, especially to help with inflammation. Maybe it's turmeric-based. Maybe it is omega-3, probiotics. How can we all do that? And then I say daily care. I know that that's maybe unrealistic for some of you, but how can we do dental care in some form every day? Whether it's a powder on the food, whether that's brushing your dog's teeth. I'm telling you what, I'm going to invest in some sort of dental finger brush for my dog. And probably at night when we go to bed, I'm going to do it. I don't know that I'm going to do toothpaste. I'm going to be totally candid. What I am going to do is rub his gums, because when those gums have that stimulation, there's blood flow. That blood flow helps to remove those toxins so that we have good bacteria and less bad bacteria. So that's something I'm going to try and commit to. I'm going to start now. Don't start when your dog has dental disease. Start as soon as you can, whether that's after the dental, and being mindful of all these other things that you have full influence and control over. So that way you're getting the phone call, or you're getting the text message, or you're getting the email. Hey, they did great under anesthesia. No extractions are needed. Everything was able to stay, and no antibiotics are needed. And so we're just going to repeat this when it's needed. So don't skip the cleanings when they're needed, but also don't depend on them every year to reset a bad mouth. Let's do what we can at home. Let's have influence over home and have that be a tool. Just like me going to the dentist for a cleaning. Imagine if that was the only time we took care of our teeth. Hello. Our dental cleaning experience would be really different, right? We'd be tapping into our insurance a lot, maybe using our HSA. We would be there a while, getting numbed. It wouldn't be pleasant, and it would cost a lot of time and money. So we can't just depend on them alone. So that's why I'm here to share my experience with you as a pet parent and tell you I get it. I go through it as well with you. So what are things you can do? Check your dog's mouth as often as possible. It can clue you into what's going on with them. And another reason why I am a fan, more of a fan, if it is appropriate for the pet, of an anesthesia dental, is unfortunately I have found oral masses, tumors in the mouth when they've been under anesthesia, because you're able to really manipulate the tongue, look down the throat. And so there is some benefit, because sometimes that's the only way you get a really good oral exam. So doing daily or weekly checks, especially if you bathe your dog once a week, make that your daily check or your weekly check to check their mouth. Is there any redness? Is there any gunk on the teeth? Is there inflammation? Are you seeing lesions in the mouth? Does the tongue look different? Absolutely. Be in tune with all that. Look at the food label. Does it list a lot of starchy carbs, corn, rice, pea protein, especially in the first 5 or 6 ingredients? Look at that. In fact, I was just seeing a pet today that is on a more non-traditional version of food. It is not a traditional meat-based food. And the first ingredients, there was oats, there was peas, there was chickpeas, and then there was one other ingredient, and the next one was sunflower oil. And I was like, inflammation, 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 inflammation. I'm not saying that those ingredients are demonizing and they're not the devil, but all those for the first few, I was like, oof. There's lots of inflammation. Not only that, if you really want to go down the rabbit hole and you really want to talk about it, these are a lot of plant-based products. Plant-based products, a lot of them have pesticides. So that's a topic for another day. But looking at their ingredients and start slow. You can add gut support. You can switch to a better food. You can brush or wipe their teeth several times a week. You can add supplements to them to help with inflammation. So there are things you can do. You don't need to perfect everything. Be more intentional with them. If your dog's mouth smells off, especially if how it normally smells, and you're like, this is different, take a look. Don't just reach for the dental chews. Don't just reach for the dental sticks. See what's happening deeper down in your dog's health. It could be cluing you in, because healthy teeth can start in the gut, and a healthy gut can start with healthier teeth. So if you want help figuring out what is best for your dog when it comes to their nutrition, when it comes to supporting them, I want to invite you to schedule a one-on-one nutrition consultation. I also want to invite you to follow along on Instagram at _non-traditional veterinarian, where I can give tips and tricks like this. If you're wanting more of that one-on-one support, that hand-holding in a way of a supportive team member, I invite you to schedule that nutrition consult. Don't neglect their teeth. Don't neglect that it's telling you something. I'm cheering you on.